Turmeric. Turmeric is a type of spice that's popularly used in cooking. It's very, very popular in India, where it's used. It's part of a popular food called curry. India, among other things, has among the lowest rates of Alzheimer's disease in the world, less than 1% of the population. And a lot of people attribute it to the fact that curry is a regular part of the Indian diet. Now, the active component in turmeric is curcumin. And most of the health benefits of turmeric result from its content of curcumin. Curcumin has been found to provide a number of benefits, most of which are related to its potent antioxidant and anti-inflammatory properties. It's an extremely good antioxidant and anti-inflammatory. There are problems with curcumin I'll talk about a little later in this video, but it's a really good all-around health supplement. In the brain, curcumin has some really impressive benefits. For example, it increases levels in the brain of what they call BDNF, or brain-derived neurotrophic factor. This could be best described as like fertilizer for the brain. It promotes the development of neurons and maintains neurons in the brain, which are basically brain cells. It increases dendritic connections, or the connections between neurons that allow them to communicate with each other. When you exercise, you also increase brain-derived neurotrophic factor, particularly aerobic exercise. So theoretically, if you take curcumin and you combine it with exercise, you get an even greater effect on brain-derived neurotrophic factor, which would have a real nootropic or brain-boosting effect. In addition, in the brain, you have something called the brain-blood barrier, which is a series of blood vessels that prevents the entry into the brain of a lot of different substances, because this is a protective mechanism of the brain to prevent noxious or toxic substances from getting into the brain. However, it also blocks out a lot of nutrients that get into the blood, but they just can't get in the brain. A good example of that is choline supplements. Choline is definitely a good nutrient for the brain because it's the precursor for a brain neurotransmitter called acetylcholine. The problem with choline supplements is that most of them don't get into the brain where it does the most good. There is some forms that get into the brain, some of the newer forms, like alpha-glycerol choline, or alpha-GPC. There's one called citrullocholine that gets into the brain, and good old lecithin, which is also known as phosphatidylcholine. That gets into the brain better than any types of choline because it's basically the most natural form of choline. But I'm diverting from the subject. I know I'm diverting from the subject, but my point is that curcumin is one of those substances that can cross the protective blood-brain barrier. And in the brain, some studies show that it helps to prevent the accumulation of two proteins called beta amyloid and tau, TAU, they're basically what they call misfolded proteins or abnormal proteins. There's normal forms of beta amyloid, and tau is only dangerous when it becomes phosphorylated. But when that happens to these two proteins, they accumulate, they kind of gum up the neurons and cause Alzheimer's disease. And some studies show that curcumin can get into the brain and actually prevent the buildup of these two proteins, and can actually remove beta amyloid. I mean, these are preliminary studies, but if that's true, this would be a tremendous nutrient. I'm talking about curcumin to be really a great nutrient to take for those who are concerned about Alzheimer's disease. Like if you have an immediate relative, it'd be a good idea to probably take some curcumin, but you have to take it in a certain way, which I'll get into later on in this video. Curcumin also shows impressive antidepressant effects. Studies that have compared curcumin and its effects on depression to the drug Prozac, which is a major best-selling antidepressant drug, show similar effects in treating depression. And unlike Prozac, curcumin has virtually no side effects. And one of the reasons why curcumin produces antidepressant effects in the brain is because it boosts the levels of two neurotransmitters in the brain, serotonin and dopamine. And both of these neurotransmitters are increased when you take antidepressant drugs. Unfortunately, antidepressant drugs take a couple of weeks to work, if they work at all. but curcumin boosts the brain levels of both of these neurotransmitters. That's probably why how it helps to relieve depression. In doing so, curcumin is, again, it can help prevent many types of brain disease and age-related decreases in brain function, including minimal cognitive impairment, where as you get older, you forget where you put your keys or where you parked your car. That's not senility or dementia. It's just it could be caused by lack of sleep. It could be a lot of things, but the point is that curcumin helps to prevent that also. Cancer is the number 2 killer of humans. Sorry. Cancer is the number 2 killer of humans. And in relation to cancer, studies have shown that curcumin can contribute to the death of cancerous cells and reduce angiogenesis, which is the growth of new blood vessels or tumors. You have to understand, for a tumor to undergo metastasis or to spread throughout the body, it has to sprout new blood vessels. That's called angiogenesis. Anything that can prevent angiogenesis is going to block the spread of tumors throughout the body and allow a much greater chance of curing the cancer. Because the way it works, doctors don't like to tell this to people, but cancer is most curable when it's found in its original site. Medically, that's termed in situ. If you can start treating cancer in its original site before it's spread, most cancers have a 90% chance of being cured. However, once the cancer has spread or metastasized, the chances of a complete cure for many types of cancer drop down to 10% or less. So you always want to, anything, again, that can prevent the spread of cancer or by the development of new blood vessels or angiogenesis, like curcumin, is very useful. I'm not saying that curcumin is a cure for cancer. Don't get me wrong. What I'm saying is it can help prevent one of the mechanisms known to cause cancer spread. I'm not saying it's a cure for cancer. Multiple studies indicate that curcumin can reduce the growth of cancerous cells in the laboratory and inhibit the growth of tumors in test animals. There's not a lot of human research, but so far it looks good as far as animal research goes. And though there is some human research. For example, a 30-day study of 44 men with lesions in the colon that sometimes turn cancerous called polyps. These are little growths in the intestine. They're considered precancerous. In fact, some people are born with a genetic condition called familial polyposis, where they're born with a lot of these polyps. And these people have a huge risk of getting colon cancer, because the more polyps you have, the greater the chance of having colon cancer or acquiring colon cancer. Because again, polyps, or these little outgrowths in the intestine, are considered precancerous cells, so they can easily turn into cancer. When you have a what is it called again? God, I can't remember the colon. The colonostomy, whatever it is, when they stick the tube up your butt, they're looking for these polyps, and in the course of that, I can't remember that word. That's amazing. This is a particular procedure, but anyway, it's a procedure to basically check, help prevent colon cancer, and the point being that when they do that, if the doctors notice any polyps, they usually remove them during the surgery, because again, these polyps are precancerous. And in this 30-day study of 44 men who had these polyps, providing 4 grams of curcumin per day reduced the number of these polyps by 40%. So you could say that curcumin helps to prevent colon cancer through that mechanism. A recent study showed that curcumin, regard to weight loss. Now, this is interesting. A recent study showed that curcumin led to weight loss in those with a metabolic syndrome. The metabolic syndrome is a constellation of syndromes, including having a wider waist, elevated blood sugar, elevated blood fats, and high blood pressure and high glucose levels, all of which are considered precursors for cardiovascular disease. People with metabolic syndrome tend to have extra higher body fat levels. And they did a study where they gave people with the metabolic syndrome doses of curcumin. And I'm just going to read from the study. It was what they call a meta-analysis. They looked at various studies where people with metabolic syndrome were provided with curcumin supplements to see if it helped them with weight loss. According to this study, the current meta-analysis indicated that curcumin consumption resulted in a detectable reduction in BMI, or body mass index, which is a poor way of assessing body composition, weight, waist circumference, leptin, and a significant increase in the adiponectin levels. Adiponectin is what they call a adipokine, which is basically it's a protein released by lipocytes of fat cells. Most of the proteins released by fat cells are inflammatory. This is the reason why obesity is so dangerous to health, because the fat cells release over 100 of these adipokines, and the vast majority of them are very, very inflammatory, which leads to systemic inflammation, which in turn favors the development of things like cardiovascular disease and cancer. But it turns out one or two of these, a couple of these adipokines are beneficial, and one of them is adiponectin. Adiponectin is associated with increased insulin sensitivity and also increased fat loss. In an animal study suppressing here we go. This is from the study, I'm reading it. In an animal study suppressing angiogenesis in adipose tissue, or the development of new blood vessels in fat tissue, downregulating pre-adipocyte differentiation, that means the development of let's say early fat cells into full-fledged fat cells. They differentiate from let's say stem cells into gets a little complicated, into full-fledged fat cells. If you can prevent that, you have less fat cells and less body fat. And upregulating adipocyte energy metabolism and apoptosis, that means the self-destruction of fat cells, by curcumin intake led to lower body fat. Curcumin intake also upregulates the gene expression of phosphorylated AMK-activated protein kinase, or AMPK, and this activated AMPK, which subsequently can function as a SIRT2 activator. It would be predicted that activators of SIRT1 in adipose tissue would decrease inflammatory cytokine secretion, reduce macrophage infiltration, and improve insulin sensitivity. In addition, inhibiting pro-inflammatory cytokines such as tumor necrosis factor A, plasminogen activator inhibitor type 1, I know this is a little technical, but I'm reading from the study, and monocyte chemoattractant protein 1 following the intake of curcumin. Basically what all this means is that these things I just mentioned, these substances, are all inflammatory chemicals associated with having too much body fat, and curcumin modulates them, it lowers them, and it also, by doing so, it helps the body get rid of body fat. That's what it all means, basically. And curcumin also suppresses 11-beta hydroxysteroid dehydrogenase enzyme. Now, what that does is it activates cortisone and it turns cortisone into active cortisol. So by reducing the problem with cortisol is when it's elevated in the body, it tends to favor central obesity. In other words, you get fat in the central trunk part of your body, in the back of your neck, and in your face also. Higher levels, as I say, higher levels of cortisol in fat cells induces central obesity. Curcumin may also reduce fat tissue growth, curb weight regain, and enhance your sensitivity to the hormone insulin. A 2015 30-day study in 44 people who were previously unable to lose weight found that supplementing twice a day with 800 milligrams of curcumin and 8 milligrams of piperine led to significant reductions in body weight, body mass index, and waist and hip circumference. Now, piperine is a substance obtained from black pepper, and it's included with various supplements, especially curcumin, because curcumin is notoriously hard to absorb. When ingested orally, most of the curcumin literally it's broken down in the liver, or it gets into the intestine, it's broken in there. You get very little absorption. Now, the people in India, when they eat curry, they eat it with oil. They mix it with oil. It turns out that taking curcumin with fat actually increases the uptake of curcumin, and so does piperine, because it's black pepper. The black pepper changes, let's say it kind of opens up the intestine, so to speak. I'm simplifying it, but the net effect is it allows you to absorb up to 2,000% greater doses of curcumin, or I should say it increases the absorption of curcumin by 2,000% over curcumin alone. That's why you see a lot of piperine added to curcumin supplements. That's still not the best curcumin supplement, which I'll talk about later. A review of 21 studies in over 1,600 people linked curcumin intake to reduce weight weight and waist circumference. It also noted increased levels of adiponectin, a hormone that helps regulate metabolism. As for the safety of curcumin, some people who take large doses of this compound may experience adverse effects such as allergic reactions, nausea, vomiting, stomach pain, constipation, skin rash, or diarrhea. I take turmeric powder that in the morning when I wake up, I just mix it with a little bit of flavored water. And it's what I take it when I wake up. I use it as an anti-inflammatory. This particular supplement is actually fortified with 95% curcumin and bioperine, or I should say piperine, black pepper extract. So it has a little bit greater absorption than straight curcumin. And I have to tell you, I use 1 scoop, but very often I get a transient stomach ache. It happens almost immediately after taking it. It only lasts for about maybe 5-10 minutes at the most, but it's something that, it's kind of a pretty big dose of turmeric to take all at once. But I've been doing it for a while. I haven't had any problems. And as far as these other side effects, I also take a curcumin capsule, which I'll explain a little bit later, that has actually 95% greater absorption than most curcumin supplements. And again, my main reason for taking curcumin is because of its anti-inflammatory activity. I have a couple of inflammatory conditions in my body, such as arthritis and a little bit of joint pain, and I take it for that reason, to help lower inflammation. People with some conditions, though, should avoid turmeric supplements. These include bleeding disorders. Turmeric may hinder blood clotting, which can cause issues in people with existing blood clotting or bleeding disorders. People with diabetes have to be careful because curcumin lowers blood glucose. To me, that's a feature because I have pre-diabetes. I tend to have higher resting blood glucose levels. So if curcumin is going to lower the blood glucose, that's just a feature for me, not a adverse effect. If you have an iron deficiency, taking turmeric or curcumin could be a problem because it hinders iron absorption, which is actually a good thing for men because men don't need to take iron. Iron is recirculated in men's body, and excessive iron, especially free or unbound iron in the blood, has been linked to increased incidence of cancer and heart disease. So again, I wouldn't call this an adverse effect. I'd call it a benefit of curcumin. If you have kidney stones, you got to be careful of turmeric or curcumin, especially turmeric, because it contains oxalates, which are also found naturally in vegetables. These are compounds that can bind to calcium and contribute to kidney stone formation. However, if you also take vitamin B6 and magnesium, it prevents the precipitation of oxalate, prevents it from solidifying with calcium, so it won't cause any problems. Most human studies suggest that the health benefits of curcumin or turmeric, well, let's talk about curcumin, are only seen at higher doses, such as those found in turmeric extracts or curcumin or supplements. Turmeric itself contains only 2 to 8% curcumin. So if you really want to experience the many health benefits of curcumin, you probably have to take a separate curcumin supplement. Now, the one I use, and I'm not going to mention the trade name or commercial name, because this is not an advertisement for companies. I'm not on the payroll of any companies, and I'm not here to boost their sales. But I will describe it. It's basically a form of curcumin that has a lipid outer layer, the type of it's packaged with something like lecithin, or some of them come with phosphatidylserine. Basically, it's the curcumin is encased with this outer lipid layer, which allows much greater absorption. Because as I said earlier, normally curcumin doesn't get absorbed. It's something like 1 to 2% absorption. Most of it's broken down in the liver and the gut. It doesn't even get into your body. It doesn't get into the blood. But when you take these, let's say, high-tech forms of curcumin, it's like a kind of a Trojan horse effect. The lipid layer around the curcumin allows it to get absorbed much better in the body. Like I said, the one I take studies show 95% increased absorption compared to straight curcumin. If you do your research, you'll find there's a couple of them out now, that have this increased absorption. My point is, if you're going to take a curcumin supplement, look for one that has increased absorption. Don't go with the regular 95% curcumin, because unless it has the black pepper or piperine or this lipid thing I talked about, it's going to pass right through you. It's not going to do nothing. So that's about it for curcumin. It's an excellent health supplement. Some recent studies also show, for those of you who work out, it also seems to help prevent muscle soreness after exercise, and that's probably related to its anti-inflammatory properties and its antioxidant properties. If you want more information about nutrition, exercise science, fat loss techniques that really work, anti-aging research you can use today, hormonal therapy, ergogenic aids, food supplement science, which ones work, which ones don't, women's health and fitness, and many, many more topics, subscribe today to my Applied Metabolics newsletter, www.appliedmetabolics.com. My newsletter is much more in depth than any of these videos. I go into extreme detail on every subject I write. After reading Applied Metabolics, I would say that most of you you could consider yourself a nutrition expert after maybe 6 months of reading my newsletter. That's how much in depth it is. And by the way, it's not in technicalese or scientese. It's all in plain English. I have 45 years of writing experience. I know how to translate technical material into plain English, and that's what you'll find. Anybody with a 6th grade education will fully understand everything in Applied Metabolics. So, and when you subscribe, I'll send you an invitation to join my private Applied Metabolics Facebook page, where every day I post new information on exercise science, nutrition, general medicine, and health. Only for subscribers can join. Only current subscribers can join that Facebook group. It's a private group. I also have an email portal on my Applied Metabolics website. Again, only for current subscribers. I don't answer unsolicited questions. You're welcome to list comments and questions under this video. I will not answer the questions under the videos. I don't have the time. However, anyone else is welcome to answer the questions. Again, I only answer questions to current subscribers of my Applied Metabolics Facebook page. I'm sorry, Applied Metabolics newsletter. And I do that as a kind of bonus for subscribing. A lot of people who have these digital newsletters, they will not answer your questions. I do it as a feature, as a bonus, because I appreciate people who subscribe. Again, it's www.appliedmetabolics.com. If you want to have the best friend you'll ever have, go to your local shelter, adopt a dog. Take care. Thanks for listening.